Let me see if Dr.
Yeah.
Levy's out there.
I'm here, John. How are you?
All right. It's Dr. Levy. All right. Well, we're just, talking about some things, waiting for you to call in.
Sure.
We're doing all right tonight, and some people on that want to hear what you have to say. Gave them a little brief description of what you do, and I figured we'd let you talk about it, and I guess we'll let you take over for a little bit.
Okay. Well, thank you so much, John,
right.
and thank you for your audience to be present. In way of introduction, my name is Stephen Levy. I'm CEO of MD Stem Cells, which is a patient facilitation organization. And my role there is, among other things, is to act as chair of the Stem Cell Ophthalmology Treatment Study 2 and to be the study director for that clinical study. And by study director, essentially it means that I'm responsible for organizing and running and logistics and so forth, papers, scientific explanations and so forth. And the Stem Cell Ophthalmology Treatment Study 2 is abbreviated by the term STOTS 2, which is an acronym for Stem Cell Ophthalmology Treatment Study 2. So we call it STOTS 2 for, to be brief. Mm-hmm. And the purpose of the study is to gather data on the use of stem cells in different ophthalmology conditions. The conditions need to be either optic nerve conditions or retinal conditions. And we have a total of 14 papers, one of them is a presentation, but 14 papers specifically on our results, spanning several years. And we continue to offer that treatment, and we continue to collect data with the ultimate purpose of helping the use of stem cells to become more mainstream. This should be a means of addressing different conditions, different eye diseases that at this point have no standard of care, no treatment that's effective other than what we've been doing. So
everybody listening, let's give your name again. This is Dr. Stephen Levy. He's talking about his studies with stem cells for eye diseases. Go ahead.
Exactly. Yeah, I'm an ophthalmologist, anterior segment fellowship trained. I did my training in upstate New York and also in Ohio. And the study itself is being conducted in Florida. So patients do have to go to Florida. It's being done in Coral Springs, Florida, which is near Fort Lauderdale. And Fort Lauderdale, for folks who aren't familiar so much with Florida, Fort Lauderdale is down in the southeast part of Florida, just a little bit up from Miami, a little bit north of Miami. So we were not affected by the recent hurricane.
Well, that's good. So, that's where you're doing the stuff. That's actually where the treatment's done, is in Coral Springs at a facility there, and that's with Dr. Weiss. Is he the one doing it?
That is correct. So Dr. Jeffrey Weiss is a retinal surgeon, trained or did a bulk of his work actually up in Boston for years. He was heading the Joslin Clinic, which is a famous retinal clinic for diabetics and, for diabetic changes in the eye. He is an ophthalmologist and retinal surgeon, and he is what's termed the investigator. The investigator is the person who does the actual treatment. And our study, STOTS-2, the stem cell ophthalmology treatment study, is what's called IRB approved, so we're under an institutional review board. People are probably a little bit familiar with FDA, that FDA approves drugs and they clear machines and devices. So there's another pathway for physicians who are doing clinical research, and that's the institutional review board pathway. That is not for new drugs. It's for different procedures, for example, different kind of surgical procedures or things that have application to the moving of tissues in the body. So essentially we're moving stem cells from one part of the body from the bone marrow to proximity to the eye. So we're under an IRB. We're listed in clinicaltrials.gov, which is the large compendium of clinical trials that the government maintains, both for clinical studies from the United States, but also from other parts of the world.
Don't you have a place in Dubai that are doing the treatment?
Yeah. Dr. Weiss also, we have a place, particular hospital in Dubai. So for patients who are from the Middle East, sometimes patients have, it's just so far away. People find it more convenient to be treated in Dubai. So he's worked in Dubai for a number of years, treating patients, as well as sometimes patients from Europe and even the United States. Yeah.
So you're also doing another study on spinal cord injuries?
Well, we're doing another study on in neurology, the neurologic stem cell treatment study, or NEST. And NEST is we're interested in treating different neurologic conditions, treating conditions that have a aspect of injury, for example, things like stroke or traumatic brain injury, or certain physical issues with the brain, like brain swelling and so forth, that might affect the vision. We're interested in, or affect other parts of the brain, let's say. We're also interested in neurodegenerative conditions, things like ALS, people may have heard of. PSP is another neurodegenerative condition. MSA, or multisystem atrophy. Parkinson's is a big one that we've had strong success in. Some people would consider it neurodegenerative. It's not as aggressive as some of the others, but certainly we've seen a lot of improvements in that. We've also seen improvements in conditions like MS and other, to a certain extent, some of the dementias, things that people might be familiar with, frontal temporal dementia, Wernicke-Korsakoff, Alzheimer's to some extent. These are more difficult conditions. So, yeah. And then the spinal cord injury, that study has drawn to a close. We are still collecting data. We have seen modest improvements in certain spinal cord level injuries. So we do think that that's something that we'll continue potentially to treat patients, but that particular study has drawn to a close. And another study that was focused on dementia has gotten folded into the NEST study. So essentially we're running two large studies now, the stem cell ophthalmology treatment study 2, which is for optic nerve conditions and retinal conditions, and the neurologic stem cell treatment study, which is for different neurologic conditions.
So how does someone go about contacting you if they want to try this, or where do they start at, and how does the treatment progress? I mean, what can they expect? Or
right. So the easiest thing is to look on clinicaltrials.gov, and you can look up, if you type in, when you do a search there, you can type in STOTS 2, just the acronym SCOTS, STOTS 2. And if you look through the study down at the bottom, you'll see my name and contact information, and you just get directly in contact with me. And
you can give out your website and phone number if you want.
Sure, of course. So for folks want to just call directly, remember I'm on the East Coast, so just take that into account for all the West Coast folks, just to keep in mind. Our telephone number here is area code 203-423-9494. Now again, that's 203-423-9494. You can email me directly. We do primarily emails is a good way to initially reach out, and it's just my first name, last name, Stephen with a V, so Steven. Last name is Levy or Levy, Lev like Victor, Y like Yankee, at MD like medical doctor, MD stem cells with an S, .com. And right, you're welcome to call us directly. It's perfectly fine. Email is somewhat preferred. We don't do anything on paper. Our website is just mdstemcells.com. Yeah, you can also look there. Yeah.
So when people, I guess they have to qualify for this type of treatment with the eyes. Didn't you say they have to have partial sight or?
Yes. So we don't treat corneal disease. For example, sometimes people have different kind of corneal problems that affect their vision, but that's not what the STOTS 2 is about. We're looking for patients who have either optic nerve problems or retinal problems. Right. So optic nerve is the nerve that comes out the back of the eye. So things like optic neuritis, different kinds of optic neuropathy, things where the nerve has a problem, things with like strokes in the nerve, something called NAION, N-A-I-O-N, where someone has a stroke in the nerve. Glaucoma is, people may have heard of glaucoma, where there's too much pressure in the eye and it damages the nerve. Our approach has shown benefit in recovering the damaged nerve, that the nerve has improved in terms of vision and peripheral vision with the treatment, assuming that the patient has their pressure under control. Yeah. Right. So different optic nerve problems. And the retinal problems, some of the big ones that people know about, dry macular degeneration or dry AMD. We've been very successful in improving vision for those patients. Different hereditary conditions, something called retinitis pigmentosa. People may have heard of that. We've seen improvements in RP. We've seen improvements in Usher. We've seen improvement with certain other hereditary conditions, things like Stargardt, for example, is another one where we have a paper on Stargardt showing a strong benefit. And some other hereditary conditions have also improved. So just because it's a gene problem doesn't mean that it can't at least have some improvement through this approach. Yeah. So very, very exciting for many patients that they have options to consider in terms of what they might do to help themselves with their vision.
And what would you say your age group is, like 60 to 90 people working with you or doing this?
Yeah, I'd say again, some of the conditions are more common among younger people. The hereditary conditions like Stargardt, for example, or RP, or certain optic nerve conditions are inherited, like dominant optic atrophy or Leber's hereditary optic neuropathy. So there are more the congenital typically is the younger people. The middle-aged people will often have damage from glaucoma or maybe potentially injuries or inflammation. Sometimes people acquire inflammation in the nerve that causes poor vision. And then older folks, as you get, past 60, I think the dry AMD is probably the most common that people contact us about. But other conditions, glaucoma certainly, and even the hereditary conditions, if they've been slow, some of them are slowly progressive. Sometimes older folks do get in touch with us, and they do have these hereditary situations. So, yeah. So it spans just like eye disease in general, spans from younger patients to elderly people certainly.
So when you do the treatment, you say you do this in a operating room, correct?
Yes, it's very important. What the literature has shown is that you shouldn't be using a local anesthetic if at all possible, because the local anesthetic, something called lidocaine or other cane anesthetics, things that like dentists use to numb up your tooth, or doctors use to numb up a cut before they stitch it up. Lidocaine and other type of cane anesthetics is harmful to the stem cell's function, and so we don't use those cane anesthetics if at all possible. We treat patients in an actual operating room. Some of the middle-aged folks have had colonoscopies and other procedures where they have to have a little IV sedation, so they go to sleep. That's the approach we use. So nothing hurts. We work with a orthopedic surgeon who does the bone marrow aspirations. That doesn't hurt. A lot of urban legend around bone marrow aspirations, but there's no harm, no pain during, and no pain afterwards. We've done hundreds and hundreds of patients, and the same thing, I always say there is no pain. If I'm ever wrong, correct me and I'll stop saying it, but that doesn't,
right.
No one has ever told me that. So it's completely painless. The procedure is done very safely. We've had no adverse events, no serious adverse events in these studies. The anesthesia people are very careful. Everything is done very safely and, in compliance with regulations that FDA puts forth. So we're in complete compliance with what they require. Yeah.
Right. The treatment, you told me, I think it takes about 40 minutes to do the whole treatment, or?
Yeah, about that. Perhaps a little bit less for the neurologic treatment, maybe a little bit smidge more for the eye treatment. For the eye treatment, patients should understand that we put the stem cells after we collect the bone marrow, and the patient's asleep for all of this. After we collect the bone marrow, it's put through an FDA-cleared Class 2 device, means a machine that FDA has said is suitable for these purposes. And we separate out the stem cell fraction, and then that's injected behind the eye, not within the eye, but behind the eye and next to the eye. And if patients have disease in both eyes, depends, of course, on the situation, but often both eyes are treated. And then the remaining stem cells are given intravenously, which is in the vein in the arm. And we don't think intravenous or IV would work by itself, but we do think that when there's stem cells already positioned adjacent to the eye, that they help call the circulating stem cells to come over too. And that's the treatment for the eye conditions. In the past, we did try intraocular or intravitreal stem cells, but the problem is that you can't put a very large amount in, and that's
where you put them in the eye.
Right, we don't do that. Not in STOTS 2. That was an earlier study we did try, but what we found was you just couldn't put enough cells inside the eye. It couldn't hold very much. So we settled on putting it behind the eye and next to the eye. That's how it's approached now. So nothing goes in the eye. Everything is essentially around the eye. And the NEST study is very similar. We do collect bone marrow, put it through the same machine, separate out the stem cells, and then that's given intravenously, which is in the vein in the arm, and intranasally, which is in the nose. And the intravenous circulates through the body, reaches the peripheral nervous system, and also can go into the central nervous system, goes into the brain through an area around what's called the hypothalamus, the circumventricular organs. There's a area of the brain that does not have a blood-brain barrier or what's called a glial limitan. So the cells are able to go from the circulation right into the brain, and this has been shown in animal models. So the stem cells go into the brain, can spread for conditions that affect the central nervous system. That's important. And the intranasal is topical. Again, the person's, there's no pain involved. And what has been shown in animal studies is that the stem cells will actually go along one of the cranial nerves and go into the brain right from the nose into the brain, a couple of different ways. And the same thing can help get the stem cells into the central nervous system. So each of these is relatively, the eye treatment's perhaps 45 minutes. The neurologic treatment maybe about 5-10 minutes less.
Well, after someone said they have optic nerve damage, and they do the treatment, and then they go home, how much time are you looking at for these cells to start growing into the eye and straightening things out? What do you think the length of time is for that?
It typically is 3 to 6 months. 3 to 6 months. So it takes a while. We know for sure when we talk about the ophthalmology treatment, we know for sure that the stem cells can actually turn into new optic nerve cells, which are called ganglion cells. That's been shown in animal models. And what happens is that the stem cells, the bone marrow stem cells, we don't use adipose. Adipose has no role in what we're doing here. So this is all from the bone marrow. So in animal studies, they've shown that the bone marrow stem cells will actually join existing cells in the retina called Mueller cells. And that combined cell goes through a transition and can actually turn into ganglion cells, which is very exciting. We think the same thing can happen in the central nervous system because the optic nerve, although technically it's peripheral nerve, it's going from the brain or going from the outside the brain into the brain is peripheral, but it comes from the central nervous system. So we think something similar goes on with the brain in the NEST study, that there's probably transition of the bone marrow stem cells into neurons and also potentially to cells that support the neurons called glial cells. Yeah. So the stem cells can actually turn into neurons and other cells. They also release special proteins, things like nerve growth factor and different neurotrophic factors that can help neurons, whether they're in the eye or in the brain or the peripheral nervous system, to help them work better and to survive stress that may be affecting them and harming them. There's transfer of what are called organelles. The cells themselves actually have little tiny structures that scientists call organelles. Organelles means like little organelles. And what's interesting is those little organs are things like mitochondria, which folks have heard of perhaps. Those are the energy-producing parts of the cell. Lysosomes, which are kind of the recycling organelle of the cell, and those can get transferred from the stem cells to the damaged cells and to help them work better, which we think is also, important in a number of conditions. The stem cells also are immune modulating. So immune modulating means that they quiet abnormal immune responses. There are a number of diseases where the immune system gets confused and starts to attack its own tissue it attacks the body. Like people know about MS, for example, multiple sclerosis, that the immune system is attacking the myelin, the cells that are the myelin. So we know that the stem cells are immune modulating. They quiet abnormal responses, and that may have a role to play in a number of different conditions, including perhaps Alzheimer's. What we're learning in Alzheimer's is that it's not only amyloid. Amyloid plays a big part, but it may be abnormal immune responses from the microglia, which are the special immune cells in the brain, the microglia attacking cells where they're not supposed to. Yeah, so that's part of it. So the stem cells do have the ability to turn into new cells. And they release things called exosomes with these different proteins and messenger interference RNA, and there's a lot of complexity in terms of what they release, but those can be beneficial. And then the transfer of organelles, things that they give of themselves to the damaged cells to help them, and then the whole immune modulation where the bone marrow stem cells help quiet abnormal responses.
So you started your studies, in 2013?
Yeah, we originally, Dr. Weiss and I were originally working in Germany and Austria, and then we came back to the U.S. and worked with, started working with an institutional review board and being reviewed and going back and forth to create these studies. And we literally started, it's probably around 2010. The actual study, I think the original started about 2000. I'd have to look it up.
I think it was 13.
But I think it might be about 2013 for the eye study.
You've been at it for a while now.
Yeah, so we're up there. We're getting. It's hard to believe, time goes by. But yeah, we've been doing it here in the States for getting up to 10 years. And all together, working together, Dr. Weiss and I, probably about 13 years. Yeah.
Amazing. So do you think in the near future that stem cells could help MS, and some of these other diseases? I mean. Yes,
we do. The thing is that it probably is not going to be a one approach answer. Right, I know. People. Of course, everybody wants a single approach that can, manage something like you take an antibiotic and you get rid of your strep throat type of thing. That's probably not the way where there's more complexity to the disease process, especially when it involves, for example, MS, where it involves the immune system. We believe that the stem cells, the bone marrow stem cells, and the approach we're using can be complementary to existing treatment. There's a lot of new treatment in MS, a lot of immune suppression, and we think that the bone marrow stem cells can be part of that process to help in terms of recovery of the neurons. In other words, suppress the immune system with existing drugs, but help repair it with the bone marrow stem cells. Yeah.
Now we've helped people with MS, by improving their diet and with different herbal products and nutrients. So that helps, improve the immune system. And
you want a healthy immune system. The problem with the immune system is it's not functioning normally. Yeah. So sometimes we don't understand why it gets. Why there's a disruption in that normal process, but potentially nutritional and other types of approaches can be useful in helping to quiet abnormal responses and help the normal responses. Yeah.
And has anybody, like, say you did this treatment once, I mean, in a couple years, could you do another stem cell treatment? Have you ever had to do that?
Yeah,
like
we've had patients do that. Yes, we've had patients where we've had improvement, especially in some of the neurodegenerative things which are very aggressive and have no real solution, or what drugs are available are a very limited, potentially of value, but still the disease is progressing. So again, we see this as because of this reparative aspect and neuroprotection aspect of the bone marrow stem cells. We see this as being part of a mix of approaches. And we're in that process of helping to establish this as both a direct approach to just go forward with a stem cell approach, but also to weave it into medical, drug treatments that can provide some different aspects of what's needed.
Because I've heard of people having stem cell treatments and then go back in a year or two and do it again, and
Yes, yeah, no, they do.
I was wondering if you do that with the eye.
We've had patients who've had improvements in different optic nerve and retinal conditions, and then at a period of time after have the treatment again and have further improvement. Absolutely.
It's just amazing that you're doing all this and all you've done in all these years. I mean, it's incredible. And I'm always trying to figure out how can we get this out to where, more doctors are doing this treatment, get it more out in the open.
We're publishing. That's a big, doctors are very respectful of scientific publication, and we're doing our best to continue that effort to publish, to do the statistics. We have great statistics in a number of the conditions that we've treated in ophthalmology. We have statistical significance, which is the buzzword you have to have. It's the gold standard in medicine. You have to have statistical significance, or else what you're doing is of no value. So we have statistical significance in a number of diseases. So all those things, medicine is very. It's like trying to steer a giant ship. It's very difficult to change course. Very difficult. It's a slow process, and medicine. Yeah, medicine is. There's a lot of momentum to the way doctors treat things, and it takes persistent, exposure to the literature where doctors, especially the newer doctors, say, "Whoa, this looks very promising and exciting," and the newer doctors, slowly replace the older doctors. And not that older doctors can't be made aware of this, but again, it's a matter of changing hearts and minds, so to speak,
right.
And being willing to go forward with things that are. Especially in conditions where there is no treatment. So many of these eye conditions, there is no treatment for dry AMD. People do, the doctors all suggest eat more vegetables, and that perhaps can help, slow things down. But or take the AREDS 2 formula, and that reduces the chances of getting wet macular, but it doesn't reverse the dry. It doesn't bring the vision back. So they have to, it takes time, and doctors are very busy, and, it's not always easy to go off and, go do research. I mean, there's tens of thousands of papers get published every year.
It takes a lot of time.
It takes, you really, until it's embraced at a populist level, and, but it's coming. It's coming. I mean, we've only really been at this about 10 years, and in the scheme of medicine, that's a very small amount of time.
Well, there's a lot of
more of this. Yeah. Go ahead, John. Yeah.
There's a lot of talk about growing new teeth and bone loss in the jaw from stem cells that they're doing studies on. But your study deals more with these other diseases in the eyes and things. So it's just,
this is so rewarding, John. I have to tell you, we're so grateful to have the opportunity to work with patients and to treat patients. There's nothing more exciting to ophthalmologists than seeing people recover vision. And we've had many patients reach out and say, thank you so much. And, there was no hope for me. And there was, I didn't know, there was nothing that anyone was doing for me. Couldn't do anything for us. And then, we came across you, and there's nothing
more gratifying. A year later, they're seeing better.
Right. There's nothing more gratifying than a grateful,
well, that's what the job is, isn't it? Isn't that the job, to help people see better? Right.
This is what drives you into, medicine in general, ophthalmology in particular, and to be able to hear that from a patient where they've benefited. It's you can't put it into words how happy that makes us.
Another thing is getting someone to actually try this, and tell them, look, here's what we do, and this is what can happen. And, they have to step up and do the treatment. So that's another part of it, actually getting them to do it.
It's a big part of what I do is to explain, not just the logistics, this is what happens, this is what we need, and this is what we do, and so on, but to go through things so that the person can understand why this might be something that they'd want to do, and to understand based on our statistics and the evidence that we have what might be expected. Because we want patients to understand as fully as possible what is likely to happen, right? Everything in medicine, there's nothing that's 100% in medicine, nothing. Even an antibiotic against a strep throat is not 100%.
Right.
So whenever you're dealing with complex issues, you have to help the patient to make a decision themselves. We don't talk people into things. We help them make a decision. Sometimes the decision is to go forward, and sometimes it's not, and that's okay. We're there to educate and to give them an opportunity, but we're not there to push. Nope.
So over the years you've been doing this, you've never really had anybody lose vision or have another serious problem from doing these treatments?
No, we've had patients who didn't benefit from the treatment. We've had patients who continued to worsen because the treatment didn't help them. That is completely true, and that's in our papers, absolutely. But the procedure itself is very safe. Nothing's zero risk. You can't get into your car or get on a plane or do anything. There's always a risk. But the risk is extremely low, and people people go have things done all the time, which you just have to do that in medicine. When you go to sleep, when you have a little bit of anesthesia, is there a risk? Yeah, there's a risk. It's a tiny risk, but there's risk.
Well, at least there's something being done to help these problems. 20 years ago, they didn't have these things going on.
No, that is correct. That is, and it's gratifying, especially when we can catch patients at an earlier stage, and can offer them some benefit and potentially improve vision or stabilize it. A lot of our patients are not. The reason that they're motivated to look for some alternative is that they're worsening. They've fallen over the cliff, so to speak, and their vision is dropping rapidly. Yeah, for sure.
Well, it's about 10 after 9. I thought maybe we'd see if anybody had any questions they wanted to ask you.
Yes, of course.
Yes.
Anybody listening, if you want to ask a question, you can go ahead with it, and everybody take your time.
Yes, I do. My name is Leon, and I want to thank you, first of all, for the work that you're doing and you continue to do is definitely well needed. And I want to thank you for coming on and doing this interview. I do like to ask a couple questions. I don't want to take up too much time from everybody else that may want to have something. So how I choose to ask these questions is going to be, because you said a lot of things and you did answer a lot of questions. So this is what I want to do. I want to put myself in a situation to come see you. This is one of the questions I want to ask you, and I'm going to put myself in a situation. I'm blind. I'm blind. I'm totally blind, and I have a prosthetic eye, a prosthesis. What could you do for me?
At this point, there's two things. A prosthesis means that the eye is no longer present or is very, very not capable of functioning in any normal way. So for a prosthesis situation, this would not be an approach. This would not be suitable to try to recover the eye. We're not that sophisticated yet. I don't know when that would ultimately be possible. There has been work done trying to actually regrow eyes, in culture. Some progress has been made, but we're probably quite a long time away from actually being able to regenerate an entire eye. Very, very complicated, but my personal feeling is that it will eventually be possible. It may be, a number of decades from now. It's not next year or even in 10 years, but I think it's possible.
Okay. The next question, I got a couple more questions, but I want to ask you just one more question. I'll let somebody else jump in.
You can always call. You can call me, and we can talk about anything that you'd like.
My next question is dealing with a person like myself. Let's take the first question off the table. And so let's say I came to you, and I'm on Medicaid or Medicare. Would y'all, the organization, accept that? And what is the price to these procedures?
Yeah, the health insurance system, whether government or private, has not covered any stem cell procedure. They do on rare occasions where stem cells are involved in cancer treatment, like special situations where the person gets their bone marrow wiped out and then there's a donor, that they do cover. But anything along the lines that we're doing is not being covered by any insurance. Even treatments of arthritis, which tens of thousands, I don't know, maybe 100,000 people, who knows, have had done, are not being covered by insurance. So there is charge, for this. We don't have any patents on this. There's no grants. We don't have any, there's no one's routinely having this paid for by insurance companies, So, and that's something I can go into with you on an individual basis.
Okay, thank you. I appreciate you asking my questions, and I appreciate the work that you're doing, and I appreciate you coming on doing the interview.
Oh, well, thank you so much, Leon. It's nice to chat with you. Okay.
Okay. This is Adrian. How you doing?
Yes, hey, Adrian.
Dr. Levy, is that your name?
Yes, exactly.
Well, I want to, Leon just said everything I was going to say, and I wish you stay out of my head sometime. But so all that's left for me to say is thank you for coming on. I've heard so much about you. And he even asked the question I was going to ask about any kind of scholarship type activity that somebody can apply to get services through you, because
we have a whole list of suggestions for patients, and I talk to the patients individually about what they might feel comfortable doing, and what sometimes there's certainly religious organizations supporting, there's unions. There's people have raised funds on GoFundMe and other websites. We've had people be very successful, literally within weeks. All the funding is there. So there's lots of different approaches, but again, it depends on the person, and we don't have a one-size-fits-all approach.
Of course,
we can make suggestions and help sort of guide people.
Do you have suggestions of people they can reach out to that might fund this treatment?
Well, we don't have a particular organization, but we can point in directions.
So there is possibility of getting help with this.
Oh, absolutely. Many of our patients have do not have the funds themselves and are able to successfully gather support. Absolutely.
Okay. Thank you.
Sure.
Anybody else have a question for Dr. Levy?
Yes. Hi, my name is Latoya. So basically everybody else touched. Hi. Everybody else touched. Hi. How are you?
Good. Thank you, sir.
Awesome. So basically everybody else basically spoke about that. Would have been the questions that I were asked, but the question was already asked, which is awesome. So I do have ocular nerve damage. I was born with spina bifida.
Okay. Well, we always, we didn't go into it too much, but one of the earliest things that we need from the patient is a recent eye exam. So if a person calls me or gets in touch with me through email, we never make any decisions over the phone, right? Because we don't ever have all the details. But what we need is a recent eye exam, and that gets reviewed by Dr. Weiss, who's the investigator. That's his job. And he will review, in his experience, both as a retinal surgeon doing very complex procedures, the most complex that is possible in ophthalmology, over decades. He couples that experience with, his work with the stem cells, what we've seen, what conditions have benefited, what conditions have not. And he puts all that together and makes a careful decision for every patient that goes through that process.
Latoya, what's the name of the condition you have?
I was born with spina bifida. I was born with a birth defect.
Have you ever heard of it? Have you ever worked with anybody with that, Dr. Levy?
Well, spina bifida is, as she's alluding to, is an area of incomplete closure of the spinal canal in simple terms. So as far as how it affects the eye, it's not typically in that area. It's usually lower in the back. So we'd have to get some better understanding exactly what was causing the optic nerve damage, or it may be from something else. I don't know. We'd have to have a better understanding of it. So.
All right.
Thank you so much for your time.
You can get a hold of Dr. Levy.
You could always call me, and again, we would need the most recent. You can call and we can discuss things, but ultimately we'll need the most recent, and typically is within a year. If it's something that's been there a long time, usually within a year is sufficient. If it's something more active and the vision is dropping, then we need something perhaps within even a few weeks. So it depends on the situation, and I'm happy to talk with you about it and help guide you as to what might be needed. Yeah.
So basically, you would go to your eye doctor, have an eye exam, and then your eye doctor would forward that information to Dr. Levy.
Right. That's it. Or the patients can get a copy themselves and send it, but we will. It's better to get a little bit of guidance first, just so you know kind of where, kind of what we're looking for in terms of what needs to be done. Sometimes we need a little bit of special testing, like maybe a visual field, or we need, some more detailed explanation about it. So, yeah, always no harm in calling. or emailing. No.
Okay. Well, I have an upcoming appointment, so yeah.
All right. Does anyone else have a question for Dr. Levy? We got a few more minutes.
Yes. My name is Ms. Daly. I appreciate all your insight. I had very, very good health and perfect eyes, and then I had a horrible spike in my blood pressure because of an accident, a bike accident coming down the hill, and it almost hit a car door. And somehow the next morning, there was a torn retina flapping. I could see it like a ripped flag or whatever. So I was thinking, well, it'll heal up by itself. And also it speaks to my fear of doctors and fear of procedures, So I waited 8.5 months, and finally it was all black, and finally someone convinced me to go to a doctor. So they reattached it, but ever since I've had quite a bit of scar tissue. I can see out of most of it, but there's maybe less than a third that's still quite, heavily scarred. But the oil is still in my eye also. But I can see, would the stem cells help with that remaining, that blockage of that scar tissue in the upper?
Well, the real thing that we would need is to get a copy of the most recent exam and have Dr. Weiss review it, because honestly sometimes the scar tissue is too extensive, or Dr. Weiss is worried that the scar tissue might pull further on the retina, so he doesn't want to have the patient have the procedure. And sometimes we've had situations with retinal detachments where there's some impairment of vision, and the rest of the retina is sufficiently protected, and that doing a treatment has improved vision. So again, complex. You obviously have a complex situation, and I can't give you a specific answer right at this point. But I hope you get in touch with us, and that we can get a copy of that exam, the most recent, and have Dr. Weiss review it.
I don't understand why there would be a pull, though, because he has been attached now since 2015, but it still has that little bit of, now some portions are lightening up where the light is coming through in some parts, but it's only one part, more than 2/3 is good. It's my left eye, and the upper right-hand corner still has some
like a shadowy area.
Yeah. So you think there would be a pull? I don't understand a pull, but
well, he doesn't want the scar tissue to increase or change and start pulling on the retina and maybe cause a retinal tear and a detached retina.
Oh, okay.
So that's why you just need to have your ophthalmologist do an eye exam. Yeah. They can print it out, and then you fax it to Dr. Levy, and then him and Dr. Weiss can look it over and have a better understanding of what's really going on with your eye, and then they can make a decision, if you're a candidate or not.
He had to take a lot of scar tissue off, but he didn't get everything, I guess. So, right. Okay, well, thank you so much.
Yes, of course. Yeah.
All right, we got about a couple more minutes. Does anybody else have a question? We're at about 25 after 9, so. Well, it looks like there's no more questions at this moment. So
I'm sorry, John.
I'll just.
I'm gonna ask what I hope is a quick question.
Go ahead.
Have you ever known uveitis to be reversed?
We have treated a special kind of uveitis called Behçet's. And we actually have seen improvements in that. Uveitis is an inflammation of the iris, so
Right.
or the uveal tissue. And usually it's treated with eye drops, steroid drops,
Right.
and sometimes,
Right.
some other medicines, sometimes, by mouth and intravenous and so forth. So it depends on if there's impairment of the vision, then we would take a look at it.
Her pupils are shut.
Yeah, completely almost.
So again, these are all complex, situations.
Okay.
If it's a mechanical thing, like the pupils are bound down, that's not something that the stem cells would, address. They can't really do anything physical, like, stick retinas down or, change, like if a tissue is bound down by scar tissue, for example, that's not something that the stem cells are going to be able to, go in and open up or, break apart.
Okay.
But the only, we would take a look. I mean, we'd review records and see if there was something that would be of value, and if not, we're very direct people. I don't know if that comes across, but we're very direct.
No,
people.
I was thinking next time I see my retina specialist, I'll ask him that specifically.
Well, what you do is you have him examine your eyes, and then he can print that out for you, and then you take it and you can fax it over to Dr. Levy, and then they can look at your information and get a better idea what's going on with your irises.
Yeah, we'll be very direct if it's something that Dr. Weiss feels is potentially, that we can be of value to you and potentially improve something. Then we'll say so, and if he feels that this is something that is either not something where the vision would be improved by this approach, or that it even potentially could lead to some additional complications, then he'll say so. Yeah, no, very straight.
Okay.
And you're dealing with experts. This is an expert. Dr. Weiss is, of course, a retinal surgeon, but an expert in this area with vast experience. This is, that's what we can provide. Yeah.
All right. Well, we're coming to the end of the program here. So, Dr. Levy, you can give out your number and website again if you want, real quick.
Yeah, sure. So our telephone is area code 203-423-9494. The website is www.mdstemcells.com. So MD like medical doctor, STEM is STEM, cells CELLS.com. You can also straight up email me as just my first name, last name, Stephen with a V, Levy or Levy, Levy, @mdstemcells.com.
All right. Well, thanks for coming on
John.
the show, Dr. Levy.
Well, it was a pleasure. It's always great to speak with you, and thank you for helping all the listeners. I mean, you're the time you donate here and everything that you do brings people great joy and a feeling
relief.
Of for sure.
It's no fun walking around in the dark and not being able to see. It's not good. And I'm going to get you on 60 Minutes here somehow.
Okay, very good. That'll be exciting. So.
All right. Well, thanks for coming on.
Be well.
We got the Concerned Sisters Coalition coming on next, family. Thanks, John. Thanks a lot. Appreciate it. And Dr. Levy, wonderful information. Thank you.
All right. We'll talk to you
Thank
guys later, and we'll be on next Wednesday at 8 p.m.
Thank you, John. Take care.
All right.
All right.
Take care.